Hi there, it's Derek here, Midlands Physical Therapy, and in this video I'm going to talk about back pain and explain some of the myths and misconceptions that surround back pain. So the idea of this video is to make it easier for someone who has back pain to understand what their pain might mean, and importantly what their pain does not mean as well. So we have a model of a human spine here. So you can see we got a vertebrae down the back. These little pointy things are the things that you can feel here at your back. They're called your spinous processes. And then you got your transverse processes here at the side. So they're little bones that come out to the side as well. In between you have your discs, and your disc is made of the same material as your ear, and that provides shock absorbency. So they're like shock absorbers, which means that you're able to move, push, pull. You're able to be in collisions and the bone won't be pressing on bone, so it provides that absorbency. Now the disc can squash and it can push out, but it can also come back in. So it's quite normal for discs to bulge a little bit, and sometimes that causes no pain at all. Sometimes it can cause pain. But I'm going to talk a little bit more about this in a minute. So coming down here you have your spinal cord, and obviously we know that your spinal cord is hugely important. Sends messages, it receives messages from your nerves around your body, send messages up to your brain as well. Now, because your spinal cord is so important, it makes sense for the body to create a strong structure to protect a very important part of your body. So the bones here are designed in such a way to offer really good protection to your spinal cord. And in between your bones here, and attaching from one bone to the other, you've got lots of ligaments that crisscross in around here, and these ligaments are very strong and they provide a lot of support. So often when people hurt their back, what happens is the ligaments get overstretched, or they get strained or sprained, and that's similar to an ankle sprain. So when you sprain your ankle, your ligaments get overstretched. When you hurt your back, your ligaments in your back get overstretched as well. And because they have, because they're beside the spinal cord, they have lots of receptors and sensors in them. So it's going to hurt. If you overstretch them, it's going to cause the sensation of pain, and it's going to be quite sore. Also, you can have muscle strains around there as well. So if you overstretch, or if you do an activity, or if you lift something too heavy, the muscle can get strained as well, and this is going to cause pain as well. So the majority of the time, low back pain is set off originally by a sprain or a strain. Now, we're going to talk about a few other things as well, and that, I'm going to look at this sheet here. So there's a lot of worry and fear when you mention back pain. Probably the first word that pops into people's heads is a disc. Now, there was a really cool study done. There's been lots of studies actually, but one was done in 2014, and it was a systematic review, which meant that it looked at, I think it was 33 studies, and it compiled all the data from these studies. Now in total it had 3,110 people who did not suffer with any back pain at all, okay? And they were people from their 20s up into their 80s. And the studies from this were quite remarkable, or the results from this were quite remarkable. So if we look at someone in their 20s, these people have no back pain. Remember, it was found that 37% of these people had disc degeneration. Okay? If we look at disc bulge, it was found that 30% of people in their 20s were found to have a disc bulge, and these people have no pain, remember. Okay? If we go up a decade, we look at people in their 30s. People in their 30s, 40% were shown to have a disc bulge. In their 40s it goes even higher, 50%. So half of the population, from 3,110 people with no back pain, had a disc bulge in their 40s. The 50s, that goes up to 60%, and so on. It goes a little bit higher as well, okay? So what does this mean? It means that your MRI report, when you go for an MRI, you're going to get lots and lots of findings. It's going to show you that you have disc degeneration, loss of disc height. There's going to be something going on with the facets. There could be possibly a disc bulge. All of these things are quite normal, and they are just what happens when you get older. Okay, there's signs of wear and tear, and you do not have to equate to your pain. Okay, so if you come out of that MRI report, sometimes they're not explained to you very well, and you come home and you show this to someone and they see disc bulge or they see loss of disc height, okay, and they can get a little bit concerned about it. Don't worry, they're quite normal, everybody has them, okay? So there's lots of other things that go on. I'm going to talk about this in other videos, but there are lots of other things that go on with low back pain that are not concerned with discs and that are concerned with your lifestyle. They're called biopsychosocial issues, and I have another video that goes into this in a lot more detail. But for today, just explaining some of the myths, misconceptions. Your back is quite a strong structure, in fact a very strong structure. It's made that way to protect your spinal cord, which is one of the most important parts of your body. So it's going to be made strong to protect that structure. So if you hurt your back, do not be thinking disc, do not be thinking any of those things straight away. They are in fact in the minority, and a strain or a sprain is in the majority. And then if you get to manage it properly, a lot of times the back pain will settle. If it's not managed correctly, or if you're told the wrong information, then it can lead to other more long-term problems, okay? So thanks for watching. Again, if you want to find out more, check out the other videos.